for those of you who were here yesterday, I did briefly touch upon the ICMR call for funding, and I'll just elaborate a little more about it. But there was a reasonable amount of interest from many of you here, some who were here yesterday, and some I'm sure have joined today. So basically, I represent the India Cancer Research Consortium, which is a brand new consortium. It just came into existence hardly 3 months ago. And one of the first things that I was told by my secretary for the Department of Health Research was that why don't we get something different from the usual ICMR, DBT, DST funding of talking about translational work for something that is nearly there but not quite there, right? And we would love to encourage multi-institutional collaborations and try and move people together in one direction, or at least in the same general direction. So this is the flyer that was released in social media some time ago, and the basic purpose for this ICRC was looking at research collaboration, providing a platform for trans-institutional alliances, as I mentioned, complementing the existing efforts and translating and disseminating research specifically with impact on the ground. We don't want to go for blue sky research. I mean, we'd love to, but at the moment, due to just constraints, we would love to see something that end results and brings change in policy or in change in practice within about 3 to 5 years. So getting a consortium together, bringing all the stakeholders together, especially researchers, healthcare professionals, various government and non-governmental organizations, as well as public health. Basically, what is the aim? The aim is to address gaps and challenges, facilitate planning and implementation, and of course, carry forward the most advanced leads. Because a lot of research, I mean, as you possibly yesterday were talking about the Lancet Commission, we talked about research priorities in India. We talked at what are the areas where medical people have been publishing. They've primarily been in head and neck cancer and cervical cancer, which is understandable. That are major problems. Both are entirely preventable, but you start looking at breast cancer, colorectal cancer, prostate, so on and so forth, there's very little work that has been done. And especially when we looked at trans institutions coming up with research grants on their own, on writing papers in international or national peer-reviewed journals, and when you compared them to multi-institutional or cross-country collaboration, there were very, very few. And I don't think in the last paper given 14, last about 5 years, things have changed dramatically. And it's actually very heartening to see all these inputs coming in from around the world. And as Dr. Usha talked about, I was lucky to get an NIHR grant just last year, so I know how those guys work, and MRC as well. But very interestingly, the amount of interest with the US, NIH, and other funding agencies have shown in India has actually declined dramatically, as can well be expected for reasons that are evident. But what has happened is the UK funding agencies have actually stepped in to a certain extent with relatively limited amount of money. But I always keep talking about when I talk to my younger colleagues, and I actually, fortunately, Dr. Usha, I've gone beyond that stage. I don't have to look after getting my name on a paper. I have enough of them. Thank you so much. I would love to encourage that, and India funding opportunities are actually quite a bit right now. It's probably easier to get money in India than to get in the US, or maybe slightly roughly on the same level as the UK, if we have a good project. So that, I think, is the bottom line. So we have, this is the organizational structure of our setup, that is under the CEO with guidance from leadership, which of course has the minister and the secretary and so on and so forth. We are a technical advisory group. We've met twice in the last 3 months, and then thematic working groups, which I'll talk about briefly, and of course the executive, which is the working part of it. And these are the various thematic areas, starting from prevention all the way to palliation, basic biology, innovation. So one that I'm really keen to support. I was just talking to my colleague who was handling this call, started just about 15 days ago, and we've had maximum number of submissions in diagnostics and therapeutics, more than what we expected actually. I would love to see where to go for prevention epidemiology, palliative care, and innovation. I mean, we have so many equipments with being made in India, and there's a lot of push from digital India and this India, that India, but what do we have to show at the present moment? I realize these things take time. For example, I'll give you something that my ex-institution, we were trying to evaluate a low-cost HPV test using a PCR, RT-PCR method, which is very inexpensive. They say it'll cost about a couple of hundred rupees. They have a similar platform for tuberculosis, which has been approved by the government. It's in the government program as a alternate to the gene expert. Doesn't require electricity, doesn't require air conditioning, doesn't require expertise to a very high level. Can be done in the patient's neighborhood at least, if not the doorstep. So that is the kind of thing which we would love to see. We've done about 700 patients. The results are, so far, what I have heard from my colleagues, are excellent. And I feel that could be, if it all works out and pans out, and it is confirmed in 2 other setups in a very different situation, not a research setup like mine, but in other hospital setups, academic setups, that could be a game changer. And a lot of people who are eyeing this place, and this is a private setup, by the way, it's not government, but we as a government institution, as a research institution at the National Institute of Cancer Prevention, we had been evaluating it. And similarly, our fellow institute in Chennai, which is National Tuberculosis Research, and Dr. Soumya was there, she had evaluated the tuberculosis part of the same company. So these are the kind of things which excite us. But we love to be at the forefront. I mean, you heard about the good news about our Indian origin person winning a Nobel Prize a couple of days ago in economics. What about Indian origin working in India? I mean, I'm sure we have the same brains. It's just that the conditions are different. So my secretary basically told me recently that we're not looking for funding from overseas. What we're looking for is a scientific rigor. We're looking for expertise, technical competence, and timeliness. Those are the, and I think Dr. Usha very clearly talked about all the different steps that we have to go through. And those of you who are into research or want to get into research, there are a few young people still around. I would love to see how I can help them, mentor them, and basically encourage them. So what are the other activities that we are looking at? Identifying research challenges. We already come up with a grand challenge called academia, industry collaboration, scaling up industry linkages. Because so far most of this stuff has been lip service, public-private. There's more of public and more of private, but there's no public-private in a real sense of the word. Advancing the research tools towards laboratory and specifically looking at public health. So this is very briefly I'll talk about this is who can apply. I will not read every word, but looking at any person who has India, we have this permanent position. Reality is that nothing in the world is permanent. You are here tomorrow, you may be gone tomorrow. Well, so to say. But what we're interested in is NGOs, private companies. The only limitation that I have is, as per the rules, that to be registered with the DSIR, which is the Department of Scientific and Industrial Research. These are the various websites where you can see the calls, and this is the salient features, looking at communication, biomarker discovery, repurposing of drugs. We just talked about repurposing old drugs, and India really should be looking at that and is looking at that in a big way. Looking at palliative care solutions, cancer immunology, and signaling pathways. These are just some of those issues. Of course, this is not comprehensive. So this is a summary. I will not take you through it again. I'll be happy to answer questions. There's a website called icrc.icmr.whatever. Oh, here it is. And I will not take any more of your time. I talked about it yesterday. I'm talking about it today. And there's a lot of buzz at the moment, both in the social media. I keep getting phone calls from my colleagues, ex-colleagues, that I have this UGC chair for 5 years. Am I permanent or not? Now, there's the kind of questions I can't answer. And half the people want to collaborate with me or my colleagues, which is not possible because I am the CEO of that, and many of my colleagues are chair people of the various teams or advisory. Unfortunately, there's a conflict of interest. We will definitely not. But they can mentor the youngsters and the second-rung people to apply, because that is really what we see the future. And I talked about yesterday catching them young, remember? And I believe Sachin and the other has just become the BCCI chairperson. So cricket is, of course, very much in the blood. So I will switch my hats to, I'm Pramesh for the moment, although very poor Pramesh. So this is Credo, which stands for Collaboration for Research Methods in Development in Oncology. And this is actually started off from Australia, if I'm not mistaken. And this is a, what have I pressed? Okay. So NCG and Credo, again, Tata Trust has been very helpful in funding a lot of this stuff. There's participation from a lot of NCG centers, developing research capacity, training statisticians, and very much something we talked in the previous lecture we heard about. So last time, if I remember right, there were about 50 odd proposals. They came up with the concept, left with the proposal. And similarly, in the last NCG meeting, for those of you who might have had a chance to be there 2 weeks ago, something very similar came up in the various expert groups. So several protocols have been funded by the NCG and various other funding bodies. And as luck would have it, this is a very nice month. October is a very auspicious month, a lot of festivals here, right? So October is the time when the ICMA grant is finishing, and November is the CRUK. So you have the ideas, you have the funding, all you have to do is connect the two dots. So this is how the Credo thing is done. They are didactic sessions, then there are protocol development sessions from faculty in India and around the world. 3 to 4 faculty members are allocated to each group, and they actually sit down with them for about 4 or 5 days in a lovely location of Lonavala, where nobody has the time to go and see Lonavala, so you just stick to the room. But my 2 or 3 of my ex-colleagues have come back, and by and large they're quite happy with it. And of course the emphasis is on clinical trials and clinical work. So at the end of the day, you have homework, just like a school kid, you have to answer back, and then you have some pre-workshop webinars as well. These are some of the pictures taken from the previous Credo sessions. They have one in Colorado in US, then you have another one in supported by ESMO in Europe and Australia. These are some of the topics that are concerned. I will not take you through each one of them, but by and large they were very similar to what the previous speaker, Dr. Menon, talked about. And then your evaluation, this is the eligibility. Of course, here again, the same buzzword, early to mid-level, and that's really the function of this particular thing. What are the choosing wisely? And if I were to choose wisely, I would go for young folks, which I'm so happy I see at least a few of them around. So who can demonstrate commitment to continued research? The concept of having a physician researcher is relatively new to this country. Most of the people who have gone on to do a PhD, or even without a PhD, who are into research, remain a handful. But the way the future is, that there are a subset of people who, by either their own inbuilt keenness to go for research, or they're forced to go for research, either initially unwillingly and then they get into willingly. And the good or bad, the number of dentists in this country is increasing dramatically, as you well know, and we don't really have the ideal job for them. And many dental surgeons are actually going in for research organizations. They're working for NGOs, and some of them are working for CROs, both public and private. And that is one area that we are very keen to access. They have been trained, at least the basis of medicine is there. They are trained in oral medicine, and some of them form really good. I'm not saying anything against the dentists, please don't take it as a negative issue, but they do form a very good core of actually people. I was recently lecturing at some place called the International Institute of Health Management, and 50% of the class of 150 students were dentists. And they have gone on not only to do research, they've gone on to join financial companies and blah, 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 which I personally feel being a dentist and joining a financial company is as bad as the MBBS or any of you guys joining the the administrative services, which some may consider good. I don't consider it a very good use of my medical training, especially when they're doing things like finance or home or something. But anyways, that's a different story. So this is the competitive application process. In 2019, 58 applications were chosen, and there are 30, so practically a 1-to-2 ratio, one faculty per 2 participants, and there were 6 international participants from Canada, Sri Lanka, and so on. So these are the various pictures that were shared by Pramesh of the workshop for the last about 4 years or so. And I will now get out of your hair and get Ramandeep to talk about the Indian Pediatric Oncology Group.